you very much for listening. Now I am going to move to the next phase, where I'm going to invite Kair Mugwaneza to the stage, who is a program manager at Center for Inclusion Health of Allegheny Health Network. Kair briefly himself is an immigrant from Rwanda, and who came to Pittsburgh as an international student, and he led one of the largest refugee settlement agency within the region. Now he serves as a healthcare professional at Allegheny Health Network. He will be our facilitator for the panel. Please join me in welcoming Kair to the stage.
Thank you very much for the introduction. Good evening, everyone. Okay, so we have a very exciting panel discussion coming up, but before that, I'm just going to make a few, just a very short remarks in regards to this event, which is connecting healthcare providers to resources, and trying to connect that to my own personal story as an immigrant who came here, and now, as you heard from the introduction, I work for Allegheny Health Network. I'm an immigrant program manager. I've been here for over a year for now. So I came in 2000. Exactly, it's going to be the end of this month, exactly 18 months in August, end of August. So I came as a student. I had a scholarship from La Roche College. It's in North Hills. Some of you may know where that is. So I had a scholarship from La Roche College to the government of Rwanda, which I applied from Rwanda. Then we came here, there were about 80 students from Rwanda who came to La Roche College. In addition to those 80, there were other 20 students from Rwanda. So altogether, there were 100 students from Rwanda who went to La Roche College, and there were other international students. So at that time at La Roche College, in early 2000, there were about 500 international students from Palestine, from Equatorial Guinea, from Jordan, from Ethiopia. It was a big group. They still have that program right now, but it's not as robust as it used to be. So I was lucky to get that full scholarship. I came here, I did my undergrad in business administration and computer information systems. But during that time, part of one of the requirements of the scholarship was to do 100 hours of scholarship of community services, which 100 hours throughout the whole program, which was very easy. So part of that volunteer program, I applied to be an interpreter for Catholic charities. That was toward, I think it was toward the end of my graduation. They had a Somali Bantu. I didn't even know they were refugees in Pittsburgh. Matter of fact, for when I got my optional practical training, that's the authorization you get if you're an international student on the F visa. You have 1 year of practicing an internship or training, so they give you 1 year authorization. So when I was applying for that, I really wanted to work with immigrants and refugees, but I had no idea there were refugees in Pittsburgh. I applied at the International Rescue Committee in New York. That's how I got my OPT. So that going a little bit back, that opportunity of being a volunteer, to be an interpreter, they were looking for somebody who speaks Swahili. I grew up speaking Swahili, and I can help with the Somali Bantu. But for some reason, that never came through. They didn't call, they didn't get back to the office at La Roche College that was organizing that volunteer program. But after I graduated, 2 or 3 months after, I got a phone call from La Roche College. Then they say that Catholic Charities is looking to hire someone. Then I went for the interview and I got a job. So that's when I started to work with refugees as a case manager, and that was in 2004. I was a reception and placement case manager. For those of you, many of you who are here who know about refugee resettlement, I know some of you who are here who are actually doing that work. So it's the case management where you receive new people, you help with the apartment setup, you go pick them up from the airport. And it was a really good experience. It was very extensive work, very overwhelming, but it was worth it. If I had to do it again, I would. So that's how I started Catholic Charities, and I stayed at Catholic Charities till for 6 years. Yeah, so toward 2011, that's when, and at Catholic Charities, after being a case manager, I also was a supervisor. Then I went to Northern area, which is the largest resettlement agency, where I became a program director for another 5-6 years. So, and that was last year. That's when I joined Allegheny Health Network, and I became a program manager. But throughout that process, the step that I want to mention that is very important regarding the session that we're having. So there were many challenges. Every student or any immigrant who come here have their own challenges. They have their own challenges going through the whole process of immigration, even employment. There are so many different types of visas, as many of you may know, and depending on the visa that you came with, that will give you the path to go through the whole process, and the process may be very different. You can be a citizen in 2 years, you can be a citizen in 5 years, you can be a citizen in 10 years, you may never be a citizen, you can go from visa to visa. So it's very complicated and very stressful. But for me, I was lucky when I worked at Catholic Charities with that 1-year employment authorization card. They were willing to sponsor my visa. So I'm saying that I was lucky because they hired me as a case manager to do the social work with refugees. They had other staff who could easily be doing my job, and they could hire somebody to do interpretation in Swahili. I think they just took upon themselves and made sure that I have that visa sponsorship. After my 1-year work authorization, they could have just said, your employment authorization is expired. You know, we're done. They could have done that. But they didn't. So that's when I had my first H-1 visa with Catholic Charities, and they even renewed to the second one. So throughout that process, I was able to go from one job to another, but it was at the first time, mainly due to that process in immigration, that I was able to get a sponsorship. The other important thing that I want to get to, which is really important, is the networking and getting the connection to get to the jobs, to get a job offer. As many of you know, and that's why we're here, is healthcare it's very important that we connect people, because we have people who have skills here in Pittsburgh. Whether it's being a professional in nursing, a doctor, or administration, social work, case management, you name it, we have people in our immigrant community who have the skills, but they can't get into that sector of work. And that's just one of them, but since we're talking about healthcare, that's what I'm focusing on right now. So that's where I think that the networking is very, very important for immigrants, international students, anyone who comes here, whether it's a new immigrant or other immigrant who've been here longer. Like you explained, we have people who come here, they already have the experience. They have the degree. We have people sitting right here who went through that process. They came here, they're already doctors. They work for years. But because of the credential and process to go through the system here, it's almost impossible to get in. And some of these professionals, some of them are willing to even go to, they're willing to be even something closer to nursing or something, to be in the hospital setting, so that they can gain more experience and get to the level where they used to be. And we're talking about people really who spend many years doing this work. Then you have another set of people who are coming here with the willingness and the skills. Then they go to school, they educate themselves. hoping that they're going to get through this sector. And they don't. And now, we're not talking about a degree, no, they get degrees from here. And healthcare is one area that applies to many other sectors. So what can we do as a community to help our immigrants who are qualified and have the skills really to move away from the surviving jobs that help them pay the bills every day, and get to a career, build a professional life that they can, in a way that they can better support their family. Like I say, I think I was very lucky. I went through some of my own challenges, but I can't compare what I went through to some of the people that I know. People who have a master's degree and they're still working in the grocery stores. There are people like that, many of them. We know them. So that's why I think what Whitetulip is doing and all for, and I want to thank you for organizing this event. That's what you're doing is really, really important. Now, it may sound that it's a very simple idea, mentor, mentee. Many of those have happened before. But it sounds simple, but it's really, really important, especially for immigrants who don't know, who don't have the connections, who don't have the networking that I mentioned that I didn't have from LaRoche College. You know, they have career programs, they will help you with the resume, but you have to be able to get out of the college and know people in your sector to start making those connections. So the mentor and mentee program is really, really important, even if I think that's the point in your program. You're not promising somebody you're going to be a doctor, but we can pair you with someone who's a doctor. They can start telling you about your work, what they've done, they can introduce you to people, and that's how you start building